Hi, Dr. Garima here again. And the reason I was so busy since the last few days not being able to shoot any of the recent ADC videos was I was busy compiling this book. I had set a deadline for myself that in this week I would just finish it. So I was doing it every day as much as I could. And yesterday I think I must have sat for 7 to 8 hours just compiling, finishing, editing, going through it, making 1400 scenario based questions on 21 textbooks, articles encompassing all the dental subjects that Australian Dental Council exam is asking questions from is a mammoth task. But then I had this idea and I was like, it's going to be so massively beneficial for all the students. Only if I had such a textbook based on the new pattern of the exam, it would have saved hours and hours of my study preparation, not to mention the anxiety that came from not having particular textbooks. There were few textbooks that I actually bought in order to read and make questions from the important topics that were asked in the exam. See, we all know that we don't have a question bank, right? Because the ADC never gives out question papers. But what they have done is they have given out the resources from which they ask questions, and those resources are not exactly the same of the textbooks that you must have read in your graduation. So these textbooks, some of them are well known to you and a lot of them are not known to you. So if you're going to attempt an exam and the questions are being asked from a textbook that you have not read, then clearly you're on a back foot, correct? So I have just bridged that gap because it's humanly not possible for you to go through all the textbooks, each and every chapter. You don't have that much time, to be honest. So I have just saved hours and hours of your preparation work and taken all those important chapters from all these textbooks which I have mentioned here in my index. These are the topics, and I would just tell you how many questions I have on each. So the first, dental public health basics by Bert. I think I'll just, no, it's okay, my WhatsApp is on the desktop, so it's giving those beepers. But anyways, dental public health basics by Bert and Eklund. I don't think so anybody of you have read this textbook, and yet so many questions were asked in this March 2025 exam. So I bought this book, I made questions on them, and I have made 80 questions on them, which is huge. Endodontics by Cameron and AE guidelines, I have another 80 scenario based questions on that. Endodontics by Tora Binijad, I have 80 questions. Implants by Wiley and Blackwell. I'm very sure none of you must have read this textbook as well. But questions are being asked from this. So again, I've made questions from this textbook and I've made 80 scenario based questions. Then motivational interviewing, something which is a very new topic. And as I keep on saying that some such things should be taught in your graduation, but they aren't. But ADC is asking questions about, these topics. So they have mentioned this textbook and resource, which again I bought it, downloaded it, and I have made questions on it, and I have made 30 scenario based questions on it. Then we have oral medicine and radiology, we have 80 questions, pediatric dentistry we have 80 questions, endodontics by Cohen we have 70 questions. I know a lot of endo, but then they have mentioned these many textbooks and their resources. So might as well you have all these questions with you. Trauma guidelines, I have 70 questions. I have two trauma guidelines here. I have the main trauma guidelines, the actual guidelines, and then I have the primary teeth trauma guidelines as well from the International American Academic Journal. So we have 30 questions on the primary teeth trauma, and the actual trauma guidelines that I've mentioned here, we have 70 questions. Coming to the most pain point, I would say, like almost all the students always ask me, Doctor, where should we study prosto from? And you have very specific textbooks given by ADC resources. I have again bought, purchased, downloaded, read, and made scenario based questions from the important topics. Okay, so for fixed prosthodontics, so we have essentials of complete denture prosthodontics, we have 70 questions. Fixed prosthodontics by Rosenstiel, we have 160 questions. FPD by far is a big pain point with all the students. And Rosenstiel is a very good book, but of course, you just cannot go through that entire textbook, make notes, and then try to memorize it. Best to study in a scenario-based question format, which is for the ADC. The more you read the questions, the faster your reading will become, the faster you'll be able to solve, because timeline is very important, right? So, Rosenstiel, we have 160 questions. Student, we have 70 questions. Minimally Invasive Dentistry by Picard. Again, I'm sure most of you must have not read it, and I have made around 20 questions on that. Bell's Oral and Facial Pain. You may have gone through it like superficially, but I doubt you must have studied in detail and in depth about it. So we have made around 80 questions from selected chapters, chapter number 7, 9, 10, 13, 14, 17, 18, which I thought were more important because questions were asked from these. So I've made questions from these. Then we have the deep caries management, around 40 questions. Periodontal classification, again a very good topic. When it was released, this article in 2020, it just changed the entire classification system, which is mentioned or for those dentists who had graduated before that. So the classification itself is simple, but there are so many variables and permutation and combinations that when you make a question out of it, you will get confused. So in order to reduce that, we have made around 70 questions, 70 scenario-based questions on just the periodontal classification was huge. But then I wanted you all to have a repeated similar kind of question so that that two charts of staging and grading gets imbibed in your head. Then prevention of oral disease by Murray is 30 questions. RPD, yes, again, removable partial denture is again a big pain point. And we have 80 questions. Then we have primary trauma, which I already mentioned, 40 questions, and vital pulp therapy, again 40 questions, because these are always asked. So I've tried to cover as much as I can, basically narrowing down your time in managing the questions and revision instead of you hunting on 10 different textbooks, opening it, making notes, saving a lot of your time and frustration and stress. This book is all that. One book, all dental subjects, total confidence is what I have named it, literally, because when I finished this book and I calculated how many questions I made, it was 1,400 questions, which is mammoth. This book plus the comprehensive book that I have released in April, which has another 440 scenario-based questions, that comprises of therapeutic guidelines, ODEL, COVID-19 questions, infection control guidelines. These things are very specific to Australia, okay? These are not your dental subjects. They take your dental subjects, but they have their guidelines, okay? That's why they are called as guidelines, therapeutic guidelines for Australia. And then we have ethics questions out there. So that is another set of 7 topics which are related more for Australia, again for which questions are being asked. So 1,400 questions of these, 400 questions of that, which makes it 1,840 questions approximately, and 1,000 plus questions of my mocks, which makes it around, say, 2,800, round figure 3,000. 3,000 scenario-based questions, and now we have 33 mock tests. Practically, if you are studying for 3 months, you're solving one mock every alternate day, and you're going through all this. I think this should be enough for you to clear the exam if your basics are strong. Okay, your basics understanding concept is also very important. You cannot mug up these questions. Only if your basics are strong, you will know the answer right away. So once you start solving and you are stuck in a particular question, you just open that topic, read, and you just move on. So that will make your study also very, what I would say, interesting and not boring. That you're sitting and you're reading a chapter and half of the things that you read may not be really relevant for the Australian exam, but you won't know that, right? What is relevant and what is not relevant. So me having that particular advantage, because I keep on seeing the question papers year after year, and I talk to the candidates, I know their weak points, so I have more data than what you do. And based on all that, when I released that comprehensive book, it was such a success, and I have so many messages from so many candidates saying that thank you so much for this book, it solves so much of their problems. that this idea just came in my mind that candidates keep asking from which book I should study, which book I should study, and I'm like, the ADC has given the resource. But is it feasible for you to sit down and read through all those textbooks? No. So what if we made questions, real-time questions on them? That would be so helpful. And all the candidates like motivated me so much that it's out of pure willingness to help. On a personal note, this is my 6th textbook, and I'm really happy and grateful and blessed that God gave me the opportunity to publish the 6th textbook. I have previously made MFD Part 1, MFD Part 2, the written exam, the YY exam. They were also very exhausting, but when I sold like 300-400 copies of this and those basically, and the candidates messaged me that, Doctor, we just read your book and we cleared the exam, and thank you so much. It helped us add another degree for our CV and in our life. I felt so happy that the efforts that I had put in and made notes, because somehow I have those instincts as to what can be asked and what you should study, from where should you study, and then I simplify that in easy concepts, as you have seen my videos. And that somehow just resonates so well with all the other candidates. And this I've been doing since first year of BDS. I used to sit with 3 pens when teacher used to teach, and it was a blue pen, and then there was a red pen, and then there was a green pen, and some of my notes are still kept in my mummy's place. When I open it now, I laugh about it. But then I used to mark in red the important points, so that when I open it, it's colorful, so it's not a boring book. And I used to just immediately have the headlines with me, and I knew what is most important, then more important, then okay to know types of things. And people used to Xerox them, they used to take my books and they used to Xerox it, and I was like, okay, if it helps them, why not? I never shied away from it. And I remember this particular incident when I was in 3rd year oral pathology. We had those specimens, and each specimen you are supposed to know a list of things, because you have to write in that 2-minute stations that you get in the exam. And I prepared a good 30-40 page notes about it, and it was just distributed so wildly. I think I just continued from there on, and wow, this is my 6th book now. I've published on All India Postgraduate Exam, my own exam paper which I had cleared, and then Dental Gulf Prometric book, the examination for DHA, and then now this. So yeah, it is very exhausting. It's not an easy task to first make sure that the answers you have are right, compile it, edit it, go through it again and again, prepare a cover page, hours and hours of hard work. So I hope this helps. Again, this is the cover page, this is the index, which I have covered so many things. And where are you going to get the ADC resource? You can just go on their website, they have very clearly mentioned, and you can see that I have taken all those things out here. Now I am releasing this sample copy basically from all these 21 topics. I have taken 5 questions each just to prepare a sample copy, so that you can go through it and understand what this is about. The original book has 1400 SBQs. The sample copy is 5 into 21, which is approximately, I would say, 105 questions on this. And yeah, it starts like this. So where I have uploaded this copy on my Target ADC Facebook group, you can find it. I've also shared it on the WhatsApp group of ADC enrolled candidates, and there are 2 other WhatsApp groups which anybody can join, the link of which I've posted in my videos as well earlier. But the easiest way for you to access this is just go through my Target ADC Facebook group. You'll have to answer the 2 questions that I've asked there. Once I approve it, you'll be let in the group. You can go in the file section out there, and you can just download the sample copy of it. So yeah, this is just to give you a gist of all the questions that I've posted, with a proper question for options and answer and explanations. So yeah, I hope this really helps. So this book plus the comprehensive book and the mock test, I think you are set for the exam. So I truly call this as one book, all dental subjects and total confidence. Thank you.